So number 4 on the list of frequently asked questions is, how is scoliosis diagnosed? So the most common way to diagnose this is just on physical exam. So your pediatrician, your school nurse, or us in this clinic can take a look at you. We have very specialized tests where you bend forward and have you touch your toes, and we look at your back to see if there's any discrepancies in the way your spine is. We can look at you and see if your hips look different or your shoulder blades look different. And this all kind of tells us that there's possibly a curvature. But the best way to prove this is with X-ray. And the X-ray takes a look at your whole back, and sometimes we even get your legs in it, so we know that your legs are equal length and your spine isn't curved because of your legs. And we actually do this what's called an EOS X-ray. It's EOS. It's a super low radiation, high quality X-ray that gets your whole body, and we can even make 3D scans out of it. It's amazing technology and has really cut down on the radiation that many of these children get. Outside of X-rays, sometimes patients need additional studies like MRIs or CAT scans. So the MRI is really important to show us that the spinal cord is all good. And in many cases it is, but we really like to prove it to ourselves. But we don't need that to diagnose scoliosis. And then CAT scans, especially in kids, we want to avoid radiation, so we almost never need it. But there are certain conditions where the bones in the spine from birth don't develop normally, and this is where it becomes super important to get the CAT scans.